Welcome to Periop Talk, where we discuss the important current surgical topics and education for you to take back to your OR. Together, we're making surgery safer, one podcast at a time.
Hi, everyone, and welcome to AORN's Periop Talk podcast. I'm Hannah Campbell, Program Manager for AORN Center of Excellence in Surgical Safety Award Programs. These initiatives cover several topics, including RSI prevention. Coming in the fall is enhanced recovery after surgery. And today's topic of conversation is on smoke evacuation and the Go Clear Award. These programs have supported hundreds of hospitals and thousands of perioperative professionals across the U.S. and abroad in advancing patient safety and surgical excellence. Participation in these programs is free and open to all. So if you're wondering, do I have to be an AORN member to participate? No, you do not, thanks to our fantastic sponsors. Today, I am honored to be joined by Marci Kling, perioperative nurse educator at Emerson Health. Marci led the charge on Emerson's journey to earning the Center of Excellence Smoke Evacuation and Go Clear Award, and she is here today to share how a grassroots initiative grew into a hospital-wide success story. Thank you so much for being here, Marci.
Thank you for having me.
Let's start with a quick overview about Emerson Health. I'd love to hear more about your hospital, and if you could just share a bit about the types of procedures your team performs.
Sure. So Emerson Health is a 179-bed independent community hospital. We're just outside of Boston in Concord, Massachusetts. We have 10 operating rooms, and we perform over 8,000 surgeries annually with robust bariatric and orthopedic programs.
Okay, great. Thanks for sharing. What inspired your team, Marci, to pursue the Go Clear Award?
So I have to say this initiative really began as a grassroots quality improvement project led by the members of our unit-based council, right? And they're comprised of registered nurses and surgical techs using AORN's evidence-based guidelines as a foundation.
Fantastic. Can you walk us through, you had mentioned on a call that we've had several calls while you were working through the program, but you had talked about this initial gap analysis that you conducted before beginning the program and how it helped drive change.
So this was really a team effort, and the UBC members performed a gap analysis through data collection with direct observation. And they discovered that compliance with smoke evacuation was only 37% across only 3 service lines due to the limited equipment availability. So this data became a very powerful tool in advocating for investing in more technology.
Wow. Yeah, the numbers speak for themselves, don't they? It's a really great way to get the program off the ground. And, leadership support is often a key to success with implementing any new program. How did you approach these conversations with Emerson Health's leadership and stakeholders to get that buy-in for the initiative?
So most conversations started at our professional shared governance meetings where unit-based council members share the projects that each unit is working on. And framing our program as a safety and quality improvement initiative helps secure support from the chief nursing officer, the CEO, and executive team. In addition, our timing was truly opportune for this initiative. In 2022, the Massachusetts Hospital Association had committed to eliminating surgical smoke from hospitals to foster a culture of safety by 2024. And the recommended action plan was to educate senior leadership and commit to implementing policy, which we accomplished. Fortunately, the Emerson executive leadership team fully supported this initiative. So we're so grateful for that.
Yeah, that's incredible. And smoke evacuation legislation, I know, is being discussed currently in Massachusetts. It's not quite yet a law. How did it influence your initiative, and how do you leverage those types of conversations to build momentum?
So I found it important to educate staff that many hospitals had already passed smoke evacuation practices into law, and Massachusetts was developing a bill which would hopefully pass as well. I found it impactful to share with both staff and leadership that this initiative was happening across the country. And this was not only the right thing to do, but we weren't alone in our efforts to take it seriously and make it happen. Our CEO is a nurse, so she truly understood the importance of this.
That's so lucky to have someone in a leadership position that's been where your team is at and understands. And you obviously mentioned that there are many states that have smoke evacuation laws and regulations in place, which is so great for those hospitals making it mandatory, but that's not always the case for a lot of hospitals interested in starting this program. So for you, smoke evacuation clearly goes beyond regulatory compliance. Why do you believe it's not just about meeting regulations that may be coming for Massachusetts, but a critical step for protecting your staff and patients?
So the Unit-Based Council members were passionate about smoke evacuation for the health and well-being of patients and staff. All of the AORN articles with evidence-based findings support and reinforce the importance of this practice. I personally have a couple of longtime OR friends who developed lung cancer, most likely from years of exposure. I teach Periop 101 to so many young nurses and even new grads, and we want to protect them from the hazards that many of my colleagues and I were exposed to over the years. I don't believe in waiting for the regulation to make it mandatory. We have to protect one another now and ourselves now, and we have to be proactive. It's just the right thing to do.
Couldn't agree more. Like you said, it's terrible to have nurses who are seasoned, who have been in the ORs for most of their lives, dealing with these health conditions likely related to surgical smoke. And I think it is so incredible that you're doing everything you can to protect the future members and nurses that are coming into the OR. Once you had the green light to start the initiative at your hospital, how did you raise awareness with your teams and build a culture of safety around surgical smoke?
So raising awareness and building a culture of safety started with education about surgical smoke. We set the expectation that all cases would utilize smoke evacuation technology and allow the industry reps to educate staff on the hazards of exposure and introduce the new equipment. To build excitement, I kicked off the program by sharing my goal for us to receive the Go Clear Award with a creative, fun, edible ashtray of pretzel cigarettes dipped in white chocolate with crushed Oreo cookie ashes and a slogan, "We are no longer smoking in the OR." It was very tasty and very well received. To educate nurses throughout our hospital, I created a poster presentation for Nurses Week explaining our efforts to keep patients and staff safe in the OR. And I think that helped raise awareness of what's going on in the OR world. After we received the award, we had the honor of presenting at AORN's annual Nursing Research Symposium. Our presentation was titled Our Journey to a Center of Excellence in Smoke Evacuation, and reviewed how we accomplished this, and which is so much of what we're talking about today.
Yeah, absolutely. And you mentioned a lot of really fun things that you did to engage your staff in this program. And I would love to get the recipe for your edible cigarette ashtray. I think that is a fabulous way of kicking off this program and making it fun and engaging and also kind of alarming, right? That's really, really neat. And I also really appreciate that you took this program beyond just earning recognition and you shared your experiences receiving the award and all of the education and auditing that you've done with future interested participants in going smoke-free. So thank you for that. We know from surveys, and we also talk about this all the time, Marci, that surgeon engagement with smoke evacuation can be challenging, especially when it comes to having to incorporate new technologies that may impact their practice. How did you navigate initial resistance and getting your surgeons on board with going smoke-free?
So I definitely leaned on the support from leadership and industry reps to help navigate any initial resistance from surgeons who struggled acclimating to the technology. Our reps basically took up residence with us for a few weeks, and they were in the ORs with the frontline users to ensure they were comfortable with the new equipment. Selection of electrocautery pencils, they were adjusted for female surgeons who felt maybe one pencil was more cumbersome than another, which I have to say was very helpful. As the educator, I supported the staff and worked closely with the reps as we continued to adapt over time.
That's really great. I like the approach that not one size fits all. You were very accommodating to everyone's needs, which I think is very helpful with getting everybody on board with using the equipment. So that's great advice. What impact has the initiative had on your team and facility culture, if any? Have there been any memorable reactions since going smoke free? Um, I'd love to hear about that and any success stories that you may have about implementing smoke evacuation.
Well, I have to say, recently, one of our staff members declared, "We don't smell smoke anymore." And it really is true. There were cases where you would smell surgical smoke in the hallways and it would be like all day. And it's very exciting to stop sometimes and recognize that has become a thing of the past at Emerson. This is something our staff are very proud of. And we mentioned this when we're interviewing potential candidates because it shows our commitment to best practice and caring for our patients and for one another.
That's incredible. That is really, I love to hear that. Wow, I'm smelling clean air. That shouldn't even be, I love to hear it, but it's like, wow, that should just be, like you said, it should be a standard. It should just be a standard. How do you plan to keep this great momentum going of smoke evacuation practices? And how do you plan to remain consistent and long-term?
The education on surgical smoke safety has continued annually. Last year, we played a game at our annual training, which was very engaging because OR staff are very competitive. This year, I created an online course and I included a review of our policy. Annual education is so important as it reminds staff why we continue to make this effort, and I think that keeps the momentum going. All of our surgical packs include the cautery pencils designed for smoke evacuation, so there's no reason for a lack of compliance. Plus, the electronic medical record includes documentation for smoke evacuation, which also enforces compliance, and this is something that I continue to monitor weekly. At this point, this is our standard of practice, and I explain that to all of our new hires.
That's incredible. And having those systems in place makes it that standard. So I think that's a great advice for hospitals that maybe are smoke-free and don't want to fall off, is continuing to track. And I'd love to mention, if you are listening and you don't have an EHR or an electronic system for tracking your ORs, the program does have a compliance audit form that you can continuously use to track compliance over time, as well as the online education of the program remains available to any new hires after you receive the award. So you can keep education top of mind for your staff to follow in line with what Marci has done that's seeming to work. So thanks so much for sharing that, Marci. Looking back, is there anything you wish you had known before starting this journey that you could share?
I have to say, collecting the data for compliance played a pivotal role in moving this initiative forward and really shifted our momentum. Numbers just speak for themselves, and it wasn't until we had the data in hand that we were able to demonstrate the lack of technology available was holding us back. I think if we had done this early on, we may have reached our goal sooner.
Yeah, that's great advice. Getting it as initial, like you said, the numbers speak for themselves, and that has really helped with buy-in as well. Well, what advice, you've already given so many great tips, but is there any other advice you'd give to facilities who may be on the fence about starting the program and wanting to earn the Go Clear Award?
So I recognize that change can be challenging, and the best way to get buy-in with staff is to explain the why behind it. Once our team members understood the composition of surgical smoke and the hazards of exposure, they became motivated to change practice. Surgeons can be more challenging, but the backing from the executive leadership team made all the difference. And with a policy in place, compliance became mandatory. I recommend relying on your industry reps to lead the product line transition and teach to their manufacturers instructions for use because they are the experts in their product. Once compliance is achieved, build the enthusiasm amongst your team to be recognized for this great accomplishment. It always helps to have a champion leading the way. And Hannah, I was very excited after attending my first conference with AORN and the Expo. I came back very excited. Receiving the AORN Go Clear Award was a very exciting moment for our hospital, something we all work on together, and it is achievable. So I recommend people go for it.
Wow, that's great advice. And I really appreciate all of your incredible work that you're doing, sharing all of your expertise that you have gained at Emerson Health and leading the way towards earning the Go Clear Award. Your team's commitment, Marci, is just stellar. And it's truly inspiring not only to us at AORN, but I know to our listeners and to future perioperative teams who may be considering going smoke-free. So thank you so much for joining us today.
Thank you so much for having me. It's an honor.
It's an honor for us as well. And a special thank you as well to our program sponsor, Medtronic, for making the Center of Excellence Smoke Evacuation and Go Clear Award program possible since 2016. Their support helps empower perioperative teams to take action, protect staff and patients, and lead the way like Marci's team has done to surgical safety. Thank you all for tuning in, and we'll see you next time.
We hope you enjoyed this episode of Periop Talk. Be sure to like, comment, and subscribe so you never miss an update. And join the conversation with us on Instagram at AORN Pics, or follow along on Facebook and LinkedIn. Looking for more perioperative resources? Visit aorn.org for everything you need, including clinical resources and educational tools. Thanks for listening.